we all know that 9/11 was physically a New York City, Pentagon, and Shanksville event, but it happened emotionally to the entire country. It even shook people internationally. So LifeNet was getting calls not from just around New York City, but it immediately started serving the nation and expanded its ability to respond to this huge volume of calls that came in over the next 3 years during the life of Project Liberty. That brought us to about 2004, when the National Suicide Prevention Lifeline proposals were being considered, and Vibrant won the suicidal prevention grant at that time, launching with over 100 crisis centers across the nation to expand the reach of the Lifeline, which we continue to do today. At the same time, John Draper, who was the executive director of the Lifeline, continued to talk to SAMHSA about the need for a 24/7 hotline that would respond to just disasters, as LifeNet did after 9/11, because John knew more than anyone what a feat it was to build up the capacity of the LifeNet in the midst of a disaster.
We said there needs to be a disaster-specific mental health program that's always there, because really all disaster mental health programs are designed to be time limited. They're funded for a certain period of time, and then they go away. But people's experience of that trauma doesn't have a timetable. It doesn't go away. There needs to be a service and care that is always there for them. So the Disaster Distress Helpline was designed to be a hotline and a helpline that would be there for anybody who had been affected by any kind of natural or man-made disaster, regardless of when it happened.
So in 2010, when Vibrant was asked to create a subnetwork to respond to the BP oil spill, John again spearheaded the discussion, urging the development of a national disaster hotline. And that's how the Disaster Distress Helpline was born. It was first the oil spill distress helpline, and then morphed into the DDH, so that people experiencing common and expected disaster distress could be connected to crisis counselors, not specifically those answering suicide calls. And the DDH, which has always been administered by Vibrant, has now reached its 10th year of serving the nation on a 24/7 basis, addressing the needs of those specifically affected by disasters.
Since our launch in 2012, the DDH has continued to grow in how we support disaster survivors and responders as they move forward on the path of emotional recovery. In the last 5 years, our call volume has increased by over 400% and text by over 600% compared to our first 5 years of service, corresponding with not only the historic COVID pandemic, but also record-breaking hurricane and wildfire seasons and too many tragic incidents of mass violence. But regardless of the size and scope of a disaster, the DDH is available 24/7, 365 to everyone in the US and its territories, no matter how many individuals and families have been impacted or the number of properties damaged or destroyed. Our goal is to meet people wherever they are and however they've been emotionally affected before, during, and after any disaster. And for this reason, over the years, we've also expanded the DDH beyond our hotline. In 2018, we launched our strengthafterdisaster.org website for sharing and accessing stories of hope and strength during recovery. And in 2021, we launched a new video phone option for deaf or hard of hearing American Sign Language users, and our DDH online peer support communities, which are private, moderated Facebook groups where healthcare workers impacted by COVID, parents and caregivers impacted by COVID, and survivors of mass violence can go to offer and receive mutual aid, connect with trained peer supporters, and access DDH crisis counselors through Messenger. When it comes to disasters, we can't control when they happen or how they happen, but we can control how we as a community respond. And over the past 10 years, the DDH has become a crucial component of the National Disaster Preparedness, Response, and Recovery frameworks. We are where you are, and if you're struggling with distress related to disaster, with the DDH available, you're never alone.